Good morning and welcome to the Senior Law Day Collaborative Wednesday morning program. My name is Sarah Steckler and I'm one of the three co-chairs of the Senior Law Day Collaborative, together with Elena Falcone from the Westchester County Library System and Melinda Bellis of Legal Services of the Hudson Valley. And we welcome you this morning. You've joined us today to learn about a very important topic about helping those living with Alzheimer's and related dementias. And we're going to present useful resources for caregivers of those individuals. And also this morning, we have some terrific panelists with us. We have Agnes Nowak, who's the program director from the Department of Senior Programs and Services. We have Jessica Flores, who's a community engagement manager and diversity specialist with the Alzheimer'S Association, who is also fluent in Spanish, so feel free to ask your questions in English or in Spanish to her this morning. And we also have Nettie Harper, who's the co-founder of Inspired Memory Care, and we're so lucky to have all of our panelists today with us. Also joining us is Colette Phipps, who is the executive director of the Livable Communities Initiative for Westchester County. So we also should give a warm welcome to her this morning. Before we start, we just want to quickly share with you our website, which is www.seniorlawday.info, where we have videos of our prior webinars, as well as useful resources to share with you. And we recently just updated and posted our Elder Law Q&A, which is a terrific and informative guide on just about everything we can think of regarding elder law. And if there's a question that we haven't answered in this publication, please send us a note on our Ask Us button on our website, and we'll do our best to answer the question and update the publication accordingly. The Ask Us button is just below the main panel on the right-hand side of the screen. So we welcome you to visit our website after the program. So without further introduction, I'm going to turn the program over to Colette Phipps, again, the Executive Director of the Livable Communities Initiative for Westchester County.
Thank you, Sarah, and good morning to everyone. Today I'm representing Jerry Brooks and Ellen Woods, who are co-chairs of the Caregiver Collaborative. And we want to thank the Senior Law Day Collaborative for this wonderful opportunity to collaborate with you all. Let me tell you a little bit about the Caregiver Collaborative. It's been a long-standing group since 1986, and we're here to meet the needs of caregivers in Westchester County. We are a group of professionals from community organizations, hospitals, assisted living, rehab services, home care, real estate. We're all over, and our goal is advocacy and education on a local, state, and national levels to support the needs of family, friends, and professional caregivers. So we're so pleased to be co-sponsoring this meeting today, and I'll hand it back over.
All right, thank you so much, Colette. And speaking about sponsoring, this morning we have a terrific sponsorship, a local law firm in Westchester County, Comer, Babe & Ullman LLP, who does elder law, trusts and estates and guardianship work, who has sponsored our program this morning. And we're very grateful to have their partnership and friendship with the Senior Law Day Collaborative and the Livable Communities Collaborative. So thank you, Comer, Babe & Ullman. And we're going to begin our program with Agnes Nowak, who needs no further introduction, who's going to share with us some very important information. So thank you, Agnes, for joining us this morning.
Good morning, everyone. My name is Agnes Nowak, and I'm the program administrator with the Westchester County Department of Senior Programs and Services. I oversee the ISEP program, which stands for Expanded In-Home Services for the Elderly. So before I introduce you to ISEP, I would like to review some options for personal care that might be available, because especially now with COVID-19 pandemic, many seniors and caregivers are looking for services and for respite care. So I am here today to provide you just with a brief overview of services that might be available to you through the Westchester County as well as other providers within our community. So when we talk about personal care, the first option for personal care is long-term care insurance, which has to be purchased privately. The disadvantage of long-term care insurance is that as you get older, the premiums get higher. The second option is private pay, where one can hire an aide and pay for services out of pocket. The average rate for a home health aide in Westchester County is approximately $25 per hour. The third option is veterans benefits. If you, your spouse, or if you're a dependent of a veteran, you might be eligible for services through the VA. Westchester County actually has an office, the Veterans Agency, which can assist you in completing the paperwork for home care or for additional benefits such as pension, and their contact information will be provided with the list of resources at the end of presentation. The next option for personal care is Medicaid, where you have the option of applying for Medicaid. Many people might be eligible for Medicaid without even knowing. Usually, the required income for Medicaid for an individual person is $875. And for a couple, the income requirement is $1,284. Medicaid looks at resources. So for an individual person, the maximum amount of resources is $15,750. And for a couple, the maximum resources are $23,100. If you are over the income, you could actually apply for what's called a pooled trust. A pooled trust is a special kind of an account which allows individuals to be financially eligible for Medicaid while preserving their monthly income in trust for their living expenses and supplemental needs. So let's say we have an individual whose income is $1,875. They might appear to be not eligible for Medicaid because they are $1,000 over the Medicaid allowed income. However, by setting up the pool trust and putting the $1,000 into the pooled trust, that makes them financially eligible for Medicaid. And with the trust, they could actually pay their living expenses such as rent, electricity, and even credit card bills, but the bills have to be in their names. Medicaid is the only health insurance that actually covers home health aides, home care, medical equipment, even diapers and dental. So the benefits of Medicaid are huge. In addition, let's say there's a married couple and only one spouse requires the services. A couple can apply for Medicaid under spousal refusal, where only the income of the spouse needing care will be taken into consideration and the budget will be considered as single. Our office works closely with Westchester Disabled on the Move, which is a nonprofit agency in Yonkers, and they assist families in applying for Medicaid at no cost. The Medicaid facilitators will assist not only with the application, but they will assist the families with selecting the managed long-term care provider and setting up the pool trust. Westchester Disabled contact information, once again, will be listed at the end with the list of resources. And finally, there is ISAP, the program I oversee. So ISAP, it's a program funded by a grant from New York State Office of the Aging. And the program is administered by my office. We are the area agency on aging. Our office covers all of Westchester County with the exception of Yonkers, Bronxville, Eastchester, Tuckahoe. These municipalities have their own offices. Their contact information will be listed in the resources as well. So just to give you an overview of eligibility for ISAP, ISAP helps older individuals with daily activities such as eating, dressing, bathing. Our services, however, are part-time and non-skilled. So there is no nursing, physical therapy. And to be eligible for the program, individuals must be at least 60 years old. They must be functionally impaired. Meaning they must need assistance with at least one daily living activity, or they might need supervision due to cognitive psychosocial impairment. This is crucial for dementia, especially for the social adult day program that we work with, and I will discuss that further in my next slides. The person must be capable of being maintained safely at home and not require higher level of care, have at least one informal support. They must be residents of Westchester County for at least 6 months. And then immigration status is not required. Finally, the person cannot be Medicaid or other program eligible, meaning they cannot receive home care services from other providers or other resources such as Medicare, adult protective services. And then these needs cannot be met by friends or relatives. When it comes to the cost of the ISAP program, each client is required to pay according to his or her ability, and charges are based on a sliding fee schedule ranging from no cost to full cost for services depending upon monthly income. The scale, once again, is determined by New York State. The income threshold for a single person is $1,595, and for a couple, $2,155. If your monthly income is equal or below these amounts, there is no cost share for services. However, if your income is over these amounts, we use a formula to calculate the cost share, which takes into consideration some of the housing expenses, such as mortgage, electricity, cable. Unlike in Medicaid, ISAP program does not look at resources. However, since we are grant funded, funding might be limited and there's a wait list for our services. So the services that ISAP provides, the first option is housekeeper, where a person is hired to provide assistance such as shopping, cooking, laundry, and other services that don't require the hands-on care. The second option is homemaker, who pretty much does the same services as the housekeeper, but in addition assists the client with bathing, dressing, transferring, or walking. We also offer consumer-directed services because we recognize that some areas in Westchester are very difficult to service, especially in Upper Westchester. So clients have the option of hiring his or her own homemaker or housekeeper. We also offer ancillary services, which is the personal emergency response system. It's a device that's worn around the neck or a wrist, and it sends a signal to a central emergency station in case there is an emergency and client's health and safety become at risk. Finally, we offer case management. So after assessment, every client is assigned a case manager who provides professional guidance. We develop a care plan and stay in contact with the client on a regular basis to make sure that their services are properly working. Let's say if a client is in need of a higher level of care, we will assist in transitioning to Medicaid. Our job is to make sure seniors are safe, they receive the right services, and live their remaining lives in dignity. This is the telephone number for our case management line, which once again will be listed in the resources.
Care, we have a question.
Yes.
Is the person who is providing the housekeeping and shopping services able to do so for the recipient's spouse, or are they only able to perform that service for the recipient?
Could you repeat the question again, Sarah? I'm sorry.
Sure. The question is, Can the person providing the housekeeping services do things like shopping and laundry for the spouse living in the house too, or only for the person who applied for services?
Only for the person that applied for the services, but if the other spouse is interested in services, they could also apply for services, and then the couple could actually share the services together.
Thank you.
And one spouse, let's say if one spouse requires higher level of care, more hours of care, we could give one spouse 12 hours of home care, and the second spouse could only, let's say, get 4 hours if they don't require as many hours.
Very good, thank you.
Thank you. So the next slide is respite care. We recognize the need for respite care. Respite care is a relief or temporary timeout from caring for a frail elderly person. Caregiving can be very stressful, and oftentimes the caregiver needs a break to address their own physical and emotional needs. Respite care can be provided by the homemaker or housekeeper. We see this in the clientele that we serve. For example, one of our cases from Lower Westchester, the husband suffered a stroke 3 years ago and never fully recovered. His wife became his primary caregiver 24/7. By having ISEP care part-time, his wife is now able to take care of her own needs and do simple tasks such as go to her own doctor or even go to the post office. Another form of respite care is a social adult day program, which is an organized program of therapeutic, social, and health activities to adults in congregate setting. It's very similar to a senior center, but more supervised and structured, especially to those patients with dementia. The program provides many activities such as reading, arts and crafts projects, exercise, baking, gardening. The goal of the program is to meet the individual needs of every client, to maintain or restore optimal capacity for self-care so social isolation can be reduced and being institutionalized could be prevented. This is definitely a great alternative for a nursing home or assisted living. ISEP presently covers 2 social adult day programs, the Warburg in Mount Vernon, and then my second home in Mount Kisco. Unfortunately, because of COVID, both programs are closed, and we have to follow the state's guidelines for reopening. So at this time, we do not have the reopening date. To be eligible for the social adult day program, every client must undergo the financial screening and assessment to see if they are eligible. Before COVID, there was no wait list for the social adult day program. The wait list for home care right now is approximately 8 to 12 months, but that is subject to change depending on funding. And at the present time, there is no wait list for the emergency response system. However, we have limited quantities, and that is subject to change. There are other respite care options that are available throughout Westchester County, and they are provided by the nonprofit agencies that we work with. One of them is Project Time Out, which is sponsored by WJCS. Project Time Out provides in-home respite and escort program with trade companions for in-home care. Just like ISEP providing respite to the caregivers, and they can assist with escort, let's say going to the doctor's visit, shopping, or taking the client to the movie. There is Dorot, which provides companion-friendly visiting calls. They have a lot of classes that could be streamed virtually now. And they also offer telephone call support groups. There's Right Connect program, sponsored by Family Services of Westchester. It also serves seniors in our community and assists seniors with shopping and delivering groceries to their doorsteps. Clients, however, are responsible for the cost of the groceries. The volunteers from Right Connect can also assist clients with transportation, and the contact information for this program will be listed with the resources as well. If you need any additional information, you can always call our case management line. The Department of Senior Programs and Services has information and assistance line. That number is also listed with the resources, and we can connect you with other resources that expand to legal, housing, home delivered meals. You can also visit our website to access the latest news, links to our publications, and many other resources. Thank you.
Thank you, Agnes. That was terrific and most informative. Hopefully, we'll be able to help some people sign up for services or to give them some direction. So thank you so much for being with us this morning. So our next panelist is Jessica Flores from the Alzheimer'S Association, and she's going to review some caregiver programs that her office offers, as well as a couple of key reminders and takeaways for our audience today. So thank you so much, Jessica, for joining us.
Thank you, Sarah. Hello, and welcome to our session, COVID-19 and Caregiving. Today, we are going to take a brief look at COVID-19 and dementia, some tips for our caregivers, and the resources that are available through the Alzheimer'S Association. While no research indicates that dementia increases the risk for COVID-19, just like dementia does not increase the risk for the flu. However, dementia-related behaviors, increased age, and common health conditions that often accompany dementia may increase this risk. Cognitive impairment makes it difficult for individuals that are living with dementia to self-protect because a vulnerable person may not understand the risk of the disease or remember to be as careful, and this makes the person with dementia more vulnerable. For example, a person that is living with Alzheimer's disease and all other type of dementia may forget to wash their hands or wear a mask and take other recommended precautions to prevent illness. In addition, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia. Now we are going to take a few look at tips for our caregivers at home. If you are someone that is living, caring for someone who's living with dementia, it's important that you research and know what you can do to protect yourself and others during this pandemic of COVID-19, and what additional steps you can take to protect yourself and your loved one to reduce the spread of the COVID-19. Caregivers of individuals that are living with dementia should follow the CDC guidelines and should consider the following tips. People living with dementia may need extra and/or written reminders and support to remember important hygienic practices from one day to the next. Consider placing signs in the bathroom or elsewhere to remind a person to wash their hands with soap every 20 seconds. Others may need to demonstrate the action of washing your hands thoroughly. And the degree of assistance that a person may need really depends on the extent that their dementia has progressed. You want to incorporate the CDC guidance into your daily routine and the routine of your loved one. You want to make sure that everyone wears a mask. Anyone that enters your home should be wearing a mask also. And of course, you want to clean and disinfect the frequently touched surfaces. For people living with dementia, increased confusion is often the first symptom of any illness. If a person living with dementia shows rapidly increased confusion, contact your healthcare provider for advice. Be aware that older adults with COVID-19 may not always have typical symptoms such as fever and cough. You want to ask your pharmacist or doctor about filling prescriptions for a greater number of days to reduce your trips to the pharmacy. You also want to think ahead and make alternative plans for the person that's living with dementia should any adult daycare or respite services. Like we already know, some of them have closed, modify their hours, or their programs could be on hold. You also want to make sure that you have a caregiver backup in case your primary caregiver becomes ill. And you want to make alternative plans for care management if any other emergency should arise. People with dementia that have COVID-19 symptoms can include increased agitation, increased confusion, sudden sadness, coughing, difficulty breathing, fever, chills, muscle pain, sore throat, and new loss of taste or smell. The CDC has also provided guidance to facilities on infection control and prevention of COVID-19 in nursing homes. And this guidance is for the health and safety of the residents and staff. And precautions may vary based on your local situation. So of course, for more information, we encourage you that you visit cdc.org. And you also want to check with the facility regarding their procedures for managing COVID-19 risk. Ensure that they have your emergency contact information and the information of another family member or friend as a backup. Do not visit your family member if you have any signs or symptoms of illness. And depending on the situation of your local area, facilities may limit or not allow visitors. And this is to protect the residents and staff. But of course, it can be difficult if you are unable to visit your family member and your loved one. And if visitation is not allowed, ask the facility how you can keep in contact with your family member. And some of the options can include having telephone calls, video chats, or even emails to check in. If your family member is unable to engage in calls or video chats, ask the facility how you can keep in touch with the staff in order to get updates. If your loved one resides in a facility, you may want to, or if you decide to maintain your loved one in a facility, you may want to ask the facility about their quarantine procedures. What are their level of confidences that CDC guidelines are being followed? How many people in the facility have been impacted by COVID-19? Have staff been impacted? Have residents been impacted? Is your family member able to follow social distancing procedures with or without help? Does the facility have personal protective equipment? How many staff members interact with your family member on a regular basis? Is the facility able to limit this number? Is the facility adequately staffed to provide the level of care that is required? All of these are important questions that you should be reaching out to your facility with. If you are considering moving your family or your loved one to another residential facility, really there is no way to know whether the new facility will remain free of COVID-19 cases. Of course, you want to make sure that the current facility that you're looking to move your loved one is accepting your residents. Have there been any other COVID-19 cases in this facility? And you basically want to ask the same questions that we saw on the previous slides about maintaining the person in the facility, regarding staff procedures, and so on. It's important to know that there are no simple answers, and this time there is no way to completely eliminate the risk of your family member being exposed to COVID-19. However, there are some questions to consider if you're faced with the situation of moving your loved one from a residential facility, moving them back home, right? So you want to ask yourself, what level of care does the person need on a day-to-day basis? And you want to ask the facility staff as well. Is your family able to provide the level of care needed? Assess the number of people needed to provide adequate care while also limiting the number of people who have contact with the person living with dementia. Does anyone in the family have COVID-19 or are showing possible symptoms? Are there individuals in the home who work outside the home? Will you need to hire home care workers? These are all questions and things that we need to take a look at before we consider moving our loved one back home. Family caregivers may need to adjust their usual routines, and it's important to continue to engage the person living with dementia, whether it be including them in regular tasks or planning activities that you both enjoy. As you can see on the screen, we have some activities that we can recommend that you can do at home with your loved one. And of course, you can always visit our website, www.alz.org/care, where you can see samples of simply daily plans that you can put in place. Of course, keeping in mind the skills and abilities of your loved one. And you also want to focus on the enjoyment and not the achievement of the task and activity that you may have in mind. You also want to be mindful of the environment that surrounds the person with dementia. Are they being exposed to upsetting content, news, TV shows, movies, noises that could increase their anxiety and stress? So a sample of a daily plan, as you can see in the screen, it could be a morning routine of washing, brushing your teeth and getting dressed together, perhaps preparing and eating breakfast together if this is something that your loved one enjoys to do, reminiscing over old photos, and of course, any routine that you decide to have, it's important that you consider taking a break and having some quiet time. We also recommend that any caregiver be patient with your loved one and give them the information that you think that they can understand and respond to them on an emotional level. People living with dementia often have trouble comprehending why things have changed. Reassure them that you are there to take measures to ensure that they're going to be okay, and focus on the positives as to not increase their anxiety. As a caregiver, you provide care to people who need ongoing assistance with everyday tasks on a regular basis. Caregivers often experience stress due to heavy workloads, fatigue, and other situations that can come with an emergency, and in this case, with a pandemic. And some of the symptoms of caregiver stress are listed on the screen, and you can see that they are denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, a lack of concentration, and health problems. It is important more than ever that you find ways to take care of yourself, even if it's a brief break to take a walk, or read a book, or do something that you enjoy. And to take care of others, you need to feel well yourself and be able to think clearly. And something that's extremely important to do is to know what resources are available to you. You need to know how to access these resources, how to remain connected with the community and have that support system. Perhaps you may want to attend a support group and socialize with other people that have the same situation, are going through your same struggles. Maybe that could be a way to relieve your stress. Of course, you have to be mindful, and you want to take care of yourself, your mind, your soul, and your body. Make sure you incorporate some physical activity, have some mindful meditation and relaxation techniques, anything that could relieve that stress and fatigue. The Alzheimer's Association is here to provide information, education, and support. Our 24/7 helpline is 1-800-272-3900. And this is a free service that is available around the clock, 365 days a year. And through this free service, specialists and master level clinicians offer confidential support and information to people that are living with the disease, their caregivers, families, and the public. You can speak confidentially with master level care consultants for decision-making support, crisis assistance, and education on issues families face every day. You can also learn about the symptoms of Alzheimer's and other dementias, find out about local programs and services, get general information about legal, financial, and care decisions, as well as treatment options for managing the symptoms. And you can receive help in your preferred language through bilingual staff or translation services. We accommodate more than 200 languages. We also have a live chat feature available. And of course, if you need to access support through our TTY service, if assistance is required via a teletype device. The Alzheimer's Association has transitioned all of our in-person programs to a virtual platform, either by webinar or phone. And these programs are available to you for free, and you can find more information by also visiting our website, www.alz.org, where you can find free online e-learning programs such as the 10 warning signs, understanding Alzheimer's and dementia, and so on. We also have our community resource finder, when you can get easy access to resources and community-based programs and services. And ALS Connected is the association's very active online community for caregivers and people living with dementia. And you can browse the forums without creating a profile. If that's the way that you prefer, you can directly learn from caregivers. If you do want to post a question or participate in the chat, you would have to create a profile. Of course, the service is free and available for all our caregivers. Our Alzheimer's Navigator is a free online tool that helps guide our caregivers to answer any questions by creating a personalized action plan and linking you to information, support, and local resources. You can visit www.alzheimersnavigator.org. And this concludes our session. Thank you for being with us this morning.
Jessica, we're not quite done yet, but thank you so much for your segment. We're just going, so everyone stay with us because we still have more information for you. And we're going to just mention that Family Services of Westchester has a gatekeeper program that also provides free counseling services in addition to the Alzheimer's Association. And if you Google Family Services of Westchester, you'll be able to access that information as well. So before we continue the next segment of our program, I'm just going to turn this over to Bruce for a quick announcement from our sponsor. And yes, we just had a question come in about materials from the program. They absolutely will be available, as well as this full recording on our website after the program, which will be found at www.seniorlawday.info. And those materials and videos are generally posted 24 to 48 hours after a program has been completed. So you'll be able to access them there. If for whatever reason you can't find them, send us an email and we'll be able to send them directly to you. You can email me directly at steckler@kblaw.com. So Bruce.
Thank you, Sarah. I just wanted to thank our sponsor, Comer, Bave and Ullman, the law firm, which has 7 practice areas. They do elder law, trust and estates, family and matrimonial law, personal injury, corporate business law, real estate, and litigation. And I'm just going to share very quickly the website. Their main office is in New Rochelle, and we thank the firm and especially our committee member, Patty Bave, for your support, and feel free to visit this website. Thank you, Sarah.
Thanks, Bruce. So we have one more terrific speaker for you. Her name is Nettie Harper. So if you would come back on the screen. And Nettie is the co-founder of Inspired Memory Care. And she has some terrific information to share with you this morning for caring for your loved ones with Alzheimer's and dementia. Thank you, Nettie, for joining us this morning.
Okay, give me just a minute. I'm going to share my screen. Okay, looks like we are ready to go. And again, thank you for having me here. for this important caregivers panel, and we'll get started. All right, so when we're talking about fostering engagement and focusing on feelings, we're exploring ways to foster and connect, but we all need to really remember that underneath everything, we all want the same. We want opportunities to feel loved, appreciated, cherished. We want joy in our life, and we want to feel needed and feel that we're part of something. So when planning for programs, remember to focus on the feelings. And Jessica mentioned that earlier, that we're all still feeling these emotions. It's not about the end product of the program, rather it's the connectedness that you feel through the activity or the program that you're experiencing. So I just wanted to kind of, as I go through to kind of mention some of the programs that are available, let's just remember that it's not about like, we have to do the gardening or we have to do this, and now because of the pandemic, we can't do all these. It's really about what are the feelings and how do we create those opportunities to connect again. And there are ways, and I'm going to share with you a lot of opportunities that are out here, not only in New York, but because things are happening virtually, we can tap into other states or other countries now. And I also want to just mention that I'm going to list a lot of resources, but no worries, you don't have to write them down. As Sarah mentioned, we have this as a recording, and all the panelists were kind enough that we put all of our resources together so that you're going to be able to tap into any of the links, have all the phone numbers, and that is also going to be on the website for you. So don't worry, you can sit back, relax for the end of this presentation, and just take it all in, all right? So routines are important, and Jessica mentioned that also. We know currently with COVID-19, finding a routine may be more difficult. Some of us are juggling caring with work, kids, spouses, and an inability to get out of the house, some of us. So we hope that after today, you will find more resources to draw from to fill the day with meaningful experiences shared together while feeling safe with family and friends. So I just kind of listed why it's important to have a routine. It keeps a natural rhythm to the day. It also prevents us from becoming overly exhausted or bored. Creates a sense of comfort, creates a sense of control. I know that I have a certain routine. So it's not just people living with a cognitive change, it's about all of us developing that routine. And we also need to look at, when we're looking for meaningful experiences, look for opportunities for cognitive, physical, spiritual, and emotional opportunities for providing connectedness. The other thing we want to look at is typically when my co-founder and I were talking to family care partners, they're like, well, I call every day in the morning. And then we talked with another family member and they're like, I call every day in the morning too. And then there's all of these calls that are happening in the morning, and then there's nothing in the afternoon and nothing in the evening. So what we would encourage you to do is really gather family and friends to coordinate regular phone calls with your loved one living with dementia throughout the day. And make it consistent, because then that helps with the routine. And then you can also think of other things that you can do. So it may be phone calls, it may be FaceTime, it may be Zooms. And don't worry if you have somebody who's living with the cognitive change and you're like, I'll never help them figure out Zoom. There are opportunities out there. There's a company called Senior Planet that will help. There's a company called Can Do that will help. And they work with elders in how to work with Zoom and FaceTime, because we all know in this time, we need that technology to have more connectedness. So again, what we want to do is figure out what may be able to happen. And then if we have a challenge, what companies are out there that can support you with it? Because what we found with our clients, that we've utilized YouTube for some Broadway musical clips, and they're short and sweet, and we can do that on a Zoom, and we're singing along and we're talking about it, and that creates a wonderful opportunity to share in an experience. So we actually curated a Broadway musical list that we're sharing with you. We also would encourage you to look into incorporating your grandchildren. We don't want our elders to miss out on opportunities with grandchildren. And so we listed a site where there are free stories. And then what you can do is zoom in with the grandchild, and then the elder can read to the grandchildren. And again, a lot of the things I'm talking about today are free. So nothing better than free, right? Okay. The other thing we need to look at is changing the conversation. And I just want to reiterate, Jessica mentioned this also from the Alzheimer's Association. Let's not focus on, what is bringing us heartache and sadness right now of the COVID-19, politics and protesting. So many times when we're speaking to care partners, they're saying, my loved one is really angry and they're sad. And then we say, well, what is the conversation centered around? And we're centering around the news, and we're centering around all of these sad things that are happening in our world. So we need to change the conversation. What brings to a loving heart? What brings joyfulness? So what we looked at is there is a woman, Dr. Ann Basting, and she's an artist, she's a scholar, she's an educator. She's been around for years teaching this, and now is an opportunity where we can really bring the arts and create opportunities where we can change the conversation. This is what she said: the arts are a way of being in relationship, of seeing and shaping the world. She has a new book that came out this year, actually. This is one of the positive things that came out this year. It's called Creative Care, a revolutionary approach to dementia and elder care. I highly recommend it. The other thing is, if we can't, go out and purchase things right now, because we understand that, our purse strings are quite tight right now for various reasons. I listed her website as well. And one of the things she has is what's called beautiful questions. So if you're on a call, instead of talking about those 3 things I already mentioned, maybe ask some beautiful questions. What do you think makes a home, Mom? What is the best gift you can receive, Dad? Whatever you may be thinking that's a beautiful question, and she lists hundreds of beautiful questions, get the conversation started in a positive way. Let's leave the negative to the side. Because again, we who are living without cognitive change, I would venture to say we're having a hard time processing what's going on in the world. Please don't ask our loved ones to try to process what's going on when they are living with some sort of cognitive change. So let's create beautiful experiences for them. Okay. The other thing that we want to incorporate is, let's get physical. But I don't know about you. When I hear the word exercise, I'm like, nope, I'm not interested. That's not for me. But in this world right now, we are a bit more isolated, and we can't do as much exercise as we once wanted to do. And we do know that exercise, it does reduce risk of diabetes, heart disease, depression, and stroke, all of those kind of negative, things. It also prevents falls, but it improves connections among brain cells. So what the research is telling us is get at least 150 minutes of exercise each week. However, that sounds overwhelming to me, but when we break it down, it only really means move about 30 minutes a day, and walking's a good start. And I mentioned walking because people felt like, okay, well, we can't allow anyone outside, all right? But if people are living at home, and if we mask up and we wash our hands, then we can safely walk outside for short distances. So I just want to mention that still getting out fresh air and getting out and getting some fresh air and doing some walking is really good for the body. And it also creates more opportunities to have lovely things to look at. The birds, and just hearing the birds in the fresh air is wonderful to do. And right now, we do see that, out in Westchester and also in the city and elsewhere, we are seeing that physical therapists are doing some home visits. So please certainly look into if they are having some difficulty, if there's been a slip physically, that certainly see if the physician will recommend some physical therapy so we can, get back into shape a little bit. Some other opportunities virtually that we can do to let's get physical. Instead of saying exercise, I like to say let's get physical. Let's have some fun with it. Let's play some music while we're walking, or while we're doing some movement in the apartment, or turn on some music and just do some dance. Who goes wrong with dance? There's no right or wrong way. The other thing that we found is there's some great opportunity through the American Parkinson's Disease Association. They have some live streams of yoga, some Tai Chi. They also have this program called Improv Movement. And basically it's an opportunity where you can just move around. It's spur of the moment, just move around. So there's no right or wrong, and who doesn't like that? They also have Dance for PD, where they're not live streaming, they're actually recording right now because they're on a little summer vacation, but they do have unlimited access, and they have it to music. They do a little imagery with their exercise. So that might be something that you want to look into as well. And then of course I mentioned the daily walk or stroll, but of course, please let's mask up and be safe. The other thing we want to look at is music. Often memory for music remains. That means melodies can be often remembered. Music, as we know from all the research, it can boost mood, reduce agitation, improve focus. It can relieve those stressful moments, reduce anxiety and depression, of course. So I listed a couple of things that I know are still, they're either recorded sessions and some are still live streaming, thank goodness. And you can plan these things into your routine so that your loved one can have really a full schedule.
Hi, Nettie. So if I might jump in, we have a question on what resources you can recommend when a loved one with dementia is suffering from extreme anxiety and depression, and what the family member caregiver can do to try to help their loved one feel more comfortable and deal with those anxiety and depression issues.
Okay, so very good question. And I think, we had a lot of calls in the beginning, and I would recommend, as I mentioned in the beginning, a lot of that was coming, the anxiety and the depression and things like that, from the clients that we saw. And please remember that anything, and I would go as far to say any of the panelists that mentioned something, it's all very individualized. This disease affects everyone, very individualized. So it may work with one of my clients, but not with the next client. But what we noticed and what we saw as a trend, that many elders that are living with cognitive change had a heightened anxiety or became more depressed, because when this all happened, we completely shut down and we forgot about routines. We forgot that there are other ways to connect. And we got bogged down with so much of our own anxiety and depression that we weren't able to reach out and get the support that we needed to carry on. And so that's why I'm so glad that we are having these webinars, because as we see, if we can get back slowly into a routine, if we can reach out to all of these free, as I mentioned, all of these free opportunities, it can start to minimize. You may not eliminate right away. This takes time because we've been building up over the past, since March, however many months. So it's going to take time to start to minimize that anxiety, and also help the individual living with cognitive change see that there is still hope and we can still live in the way that we are right now. Keep in mind their adult day program more than likely shut down. There are opportunities of the DeRote programming. I heard that today. It shut down. So those opportunities, were taken away. I'm here to tell you we need to give things back, and that will help with the anxiety and the depression. And we need to build those schedules again for the individual living with cognitive change. And we need to stop having the conversations around the negative things as much as possible. And that's a lot on you as family care partners to weed that conversation for somebody who doesn't have cognitive change. The other thing is those TVs. Please minimize the news as much as possible, if not at all. I mean, I would eliminate it if I could. So we really need to maintain the negative over here and bring more positive into their life. Okay, so just jumping right back into music, if music is something that might be helpful in supporting their day, I list, the Manhattan School of Music, Met Opera Streams, Lincoln Center at Home, and Sing Loud for PD. And again, you can be anywhere in the world and you can stream and bring that right into your home. Oh, and I got this. Okay. All right. The other thing is, if music's not for you, then you may want to look into some museums or zoos or aquariums. The other thing that we've noticed with a lot of our care partners is we have some families that are trying to school their children at home and also take care of their wonderful grandparents or loved ones. And so we also looked into some opportunities where you can engage both at the same time. And what we found is art making activities families can do at home, and that's through the MoMA. And so what I love about it is it's appropriate for children, but also adult, because we are dealing with and managing and working with and partnering with our elders who are adults. So we need to make sure that we're not looking at children type of arts. And certainly the art making that the MoMA put out is absolutely amazing. So I encourage you to look at that. There's also some virtual walking programs and an orchid show that you can take a look at as well. The other thing that Kelly and I had the opportunity of participating in and actually helping support build is there was an NIH study that they built readers that would be appropriate for people living with cognitive change. And often what we hear is, my loved one can't read anymore, it's not possible. And then when we go in and we explore and we do a reading screening, it's because the font's too small. I don't know about you, but I currently have a hard time reading the New York Times. It's a lot of print and it's very small. So I would encourage you to kind of look into this. And this is just an example. You get one that's sent to you per week. And this is just one I picked, Broadway's Beginnings. And you can see the font is large. It's factual. But then when there's questions asked, it's very opinion based. Because what we don't like to do is ask fact-based questions. I don't know about you, but I don't like pop quizzes ever. So why are we asking pop quiz questions to our loved ones who are living with cognitive change? So again, I would encourage you to utilize these, and it's also good for working with grandchildren and school-age children as well if you want to create that intergenerational opportunity. The other thing I mentioned is cognitive and social opportunities. You know, some people don't have technology, and that's okay, because guess what? There's still snail mail that exists. And so what we like to do here is bring some visual pop to somebody's day. Who doesn't love a good old-fashioned postcard? And it has a nice visual image. So these are just two I found on Amazon. They come like 40 in a pack. The one on the side is U.S. National Parks, and then the other one is just visual images of all kinds. You can just write a note on the back, and you can create this, you know, sending a nice message in the mail back and forth, and it's lovely. It gives them something to do. They walk out to their mailbox, they come back, they're able to sit down, they respond back to you, and it has a really lovely opportunity for social engagement going back and forth. The other thing is we really can't forget people aren't going to churches at this point as readily and as available as they used to because of COVID-19. So again, I think it's important that we support our elderly with spiritual opportunities, regardless of faith and regardless of what you mean by spiritual. And so I listed the faith communities. It has all different faiths, and it gives scheduled times where you can watch it live. They also have recorded times. And then also reading scripture. And that's what I mean, going back to old-fashioned snail mail, but also old-fashioned just picking up a Bible and reading scripture to one another. When's the last time you went and just actually read some scripture back and forth? And that's something you can do simply on the phone as well. That's a positive. And then looking at some of the poems, sometimes that's very spiritual to people. The other thing is sending photos to stay connected, gathering all those friends and families again and saying, you know what, let's do something for mom or dad or Aunt Sally or, you know, Uncle Kelly, whomever it may be, and say, you know, let's take a snapshot a week and go ahead and send it to your loved one. And but what you want to do is in that large font again, because we want to make sure that they can visually see it, label exactly who is in the picture, and you can even say what's going on in the moment, because you don't want people to be guessing who it is. Not fair to keep them guessing. The other thing that you can do is take silly photos and then just write on there, Mom, this is our silly face photo. Can you send us back one with your friend, Sophie? And guess who Sophie is? Sophie's the home health aide. So involve the home health aide because they are part of the family now more than ever. They are supporting you. And so let's include them and let's be funny together. Another opportunity, let's get physical. So Nana, send us a photo back of you dancing, all right? So again, just a fun way to get people engaged and keep them on their toes and connected. And then good old Alexa. Oh, I have one in the home, so I have to be careful. but it helps us set reminders and routines. It can help us with medications, exercise, meals, to make a phone call, a grocery list. It can help us play music. It can help us know about the weather. It can also tell jokes. I don't always find the jokes so funny, but who knows? The other thing, some examples, you might say that name, the A word, and then say, tell me about London. So if you have somebody who really wants to know more about something in history or about a certain place, there you go. You might say the A word and then tell me about what happened in 1950. And then you can learn together, and you can certainly do that on the phone together. You can do that on Zoom, whatever you have available. The other thing is that's kind of fun is if they're at home and they're without a home health aide, you may just want to create what we call a template or a visual cue, and so that they can do it independently. So this is Robert's cue, one of our clients, to listen to music, say the A word, play classical music, or you can be more specific and say, Alexa, play J.S. Bach or Beethoven. So, and then it teaches them also how to stop it, how to turn the volume up or down, and then so forth. So that's an opportunity to make it more independent as well. And you want to put that template right next to where the A is. And also, as I mentioned and we went through quickly, there's so many resources out there. And again, I can't stress enough, they're for free right now. We know that we need to be in support of our family care partners and individuals living with cognitive change. So all the panelists have put together a resource list. It will be on where Sarah had mentioned. And I think it's important that you also, if you want to revisit the website, that would be helpful. And also, if you want our resource list too, and any other IMC materials, it's right here on our website, and you can find it there. And if you'd like to connect with us, here's our information. And we also have a Care Partner Q&A Mondays on Facebook Live. We discuss all various different topics, not just about COVID-19, but just in general, what's happening as people process through the dementia process, as they progress through the dementia process. Please feel free to reach out to us anytime, and we welcome all your questions. And thank you so much for your time today. Back to you, Sarah.
Thanks so much, Nettie, for the service that you're providing for the community. So before we go today, if anyone who's on with us has any questions, please type them in the chat box or in the Q&A, and we will ask our panelists to answer them for you. So we've also posted some links on caregiving in the chat. So if you have been looking for resources, we've been posting some links, so please take advantage of what's in the chat.
Yes?
I just saw a question in here. Besides the things you mentioned, what else are facilities doing to reduce feelings of isolation at this time? We happen to be connected with quite a few facilities, and they are doing window visits. They are creating a FaceTime as well. They're doing the phone calls. But also importantly, I think we should mention that there were several vendors that were coming in, like music therapists, art therapists, IMC, myself. They have created virtual opportunities so that we still keep connected to those residents, so that they are still seeing familiar faces, so that they're not like, everybody abandoned me. So I will say facilities are doing an excellent job in working through this process from what I've seen.
Thanks, Nettie. I also just wanted to mention at the point where we don't have other questions, we're ready to conclude. I'm just going to put a quick poll where you can give us some quick feedback about whether there were your feedback on how today went for you.
All right, so thank you,
Sarah,
everyone.
anything else you want to?
I just want to thank everyone for joining us from the Senior Law Day Collaborative and also from the Livable Communities Collaborative. And I also thank the Livable Communities Collaborative for partnering with us on this very important program. So thank you so much. As we're doing the poll, we had a question come in. If I see a neglected elderly neighbor, should I report it, and where should I report it?
This is Agnes. You can actually contact Adult Protective Services of Westchester County. Their telephone number is 914-995-2259.
You can also reach out directly to your neighbor and just to check on them, wear a mask, wear gloves, see if they're okay, ask if they need help with anything too.
Okay, well, I've gotten some great feedback. So thank you, everyone, and have a great day.